It doesn't matter how old you are if you feel good and you're functioning and you're able to, do things in the world. But if you're sick and in bed, that's pretty miserable.
Yeah, and oftentimes that's all that it really is. What do you say to the naysayer then, who says, oh, of course we start to lose our hormones after, our early 20s, and aging, as you say, is inevitable, and why are we trying to be something that we're not? Why don't we just accept that this is what 50 feels like and get over it?
Exactly. Well, we do a lot of other things as we age. Maybe we wear reading glasses, or older people will wear hearing aids, or do other things to help them with the consequences of aging.
Right.
And why not take hormones which are making you feel better and younger and more functional? That's in my opinion, a very natural thing to do.
Are there any downsides to bioidentical hormone replacement?
There is some controversy, again, about the risk for cancer. And that is, if there's a strong family history, for instance, of breast cancer, then a person does have to be careful about how much estrogen they take, because there are some cancers, for example, that are estrogen sensitive. So in that kind of a patient, you would have to be particularly careful about replacing estrogen, for example. But in men, even, there's been this controversy about testosterone for men with prostate cancer. And for years, it has been just accepted in this country that testosterone replacement is the worst possible thing you could do for prostate cancer. And now we know that it's the lack of testosterone as men age that actually predisposes them to prostate cancer. So if men take testosterone replacement as they age, they are less likely to develop prostate cancer. It's the same with breast cancer in women. Most women don't get breast cancer in their 20s and 30s.
Right.
They start to get things like breast cancer as they become, late 40s, 50s, 60s. That's when breast cancer hits women, and it's because their hormones have gone down. So your body needs these hormones to actually fight off cancer. Is what most people in the anti-aging medicine and the new field of medicine and longevity, those kind of studies are showing that.
Are you the only one in the area that's doing this?
To my knowledge, I'm the only one in the Tri-Valley. There are just a few doctors here and there. I mean, when I started this clinic, I started trying to find out where the other doctors were.
Yeah. Join the club.
And had a hard time finding them.
Oh.
It's kind of ironic. There's lots of these doctors in Los Angeles,
oh,
as you can imagine.
Yes,
but there's very, very few in Northern California. There's been a real sort of need for this kind of service in Northern California because in LA, of course, the interest in, youth.
Yeah, it's kind of
yeah, and this is not just for youth and looking good. I try to tell people that it's really about your health.
It's about feeling good, and I think any woman who's over, has gone through menopause will tell you, I feel differently than I used to feel, and not that there's anything wrong with different, but worse is not a good thing, and there's probably no real need for that.
It's almost always worse.
Yeah.
And, even the risk for Alzheimer's disease goes way up in men and women as their hormones decline. There are receptors in our brain for all of these hormones. The receptor wouldn't be there if those hormones weren't important for optimal brain function.
I'm going to give out your information, but just before I do so, if somebody can't get to you, is there any kind of verbiage they can say to their doctor that says, yes, I want to replace my hormones, but I want to do it with bioidenticals, and could this person do it, or is that just asking too much at this point?
Well, the doctor would probably have to, study up on it and go to some conferences and do some reading. There is a lot of information out there for anyone who's interested in it.
Yeah.
But just most doctors have a hard time thinking outside the box, is what I find.
Well, and as we were talking in our last segment, too, that sometimes you've only got 10 minutes with your patient. The last thing you want to do is bring up something brand new and a new idea and thought. Let's just sort of, how you doing, and get you out the door.
Which is why we spend 1 to 2 hours with every new patient, because it is just impossible, in my opinion, to practice good medicine in 10 minutes.
Of course.
Can't do it.
And as you talked about, it's not just about giving the blood too, you also have to know the health history of this person, because there will be some things involved. Let me give out some information. If you're wondering anything about this and you're thinking, oh, but I've heard this is dangerous, it's kind of, yesterday's information what you have, and bringing you up to date is Dr. Lynn Mielke, Optimal Health Spectrums in Pleasanton. Check out the website, that'll get you started, www.optimalhealthspectrums.com. And if you want to make an appointment, give a call. That's 925-846-8000. And people you're going to be booked out, but we need this.
Well, it's been a real need in the Tri-Valley because this is something that affects almost every man and woman over the age of 40.
Yeah, and we want to live a long time. We just want to feel good doing it.
Exactly.
So